Hi all, I will be talking about high cholesterol in diabetes and how it affects the patient as such. And what we must know about high cholesterol is that high cholesterol usually denotes a high LDL or a bad cholesterol value, which is a common accompaniment in most of the diabetic patients with other lifestyle diseases like hypertension also. So dyslipidemia can be present as such, or it may be an accompaniment in diabetes. And dyslipidemia in a diabetic patient makes him more prone for the development of heart disease. And again, it is an added risk factor in a diabetic patient. So, how will you tackle if you are a diabetic patient having high cholesterol? Again, the importance of lifestyle modifications come here. And whenever you are a diabetic patient, it should be emphasized that very strictly your bad cholesterol or LDL value should be below 100. And again, you must also consider triglycerides, which is another form of a bad cholesterol, which can also cause clogging of your arteries, leading to heart disease, especially if you are a diabetic. And the level of triglycerides should be kept below 150 milligram percentage. So, how will you tackle dyslipidemia? The first and foremost is lifestyle modifications, which include diet as well as exercise. You have to go for an aerobic exercise like walking, jogging, cycling, or swimming at least 30 minutes a day for 5 days a week. Aerobic exercise tend to increase your good cholesterol or HDL values. Doing some form of exercise like walking every day itself gives you huge benefits. And what are the dietary modifications that you can do when you are having a high cholesterol? First and foremost, you have to avoid high carbohydrate or high glycemic index foods, which along with tending to rise your blood sugar values if you are a diabetic patient, also increases your bad cholesterol values. Secondly, you have to avoid saturated fat as such. Saturated fat is present many a times in many cakes, pastries, all foods which are having some form of processing values, hydrogenated oils, and other oils which are rich in saturated fatty acids like butter, palm oil, and coconut oil. Again, when you consider unsaturated fatty acids, you have to consider rice bran oil, olive oil, and canola oil, which are rich in mono unsaturated fatty acids, which will give you good benefits towards altering your cholesterol value to a favorable level. And avoid hydrogenated oils like vanaspati completely. And last but not the least comes the importance of medications for cholesterol, that is statins. Statins have numerous beneficial effects other than lowering cholesterol values, which has other methods by which heart disease is prevented. And the commonly used statins, atorvastatin and rosuvastatin, are prescribed to you by a doctor. You should not take any cholesterol lowering medications by yourself unless the doctor recommends this. And that is it. You have to always control your cholesterol values when you are a diabetic patient. Thank you.